Items you will need for giving subcutaneous fluids at home are fluid bags, an IV line, and needles. You will get all these items from your veterinarian. There are several different types of bags that have different ports on them. This one has a button port, and this one has an injection port coming off the bottom of the bag. Both of these have a separate port than the injection port where you will plug in the IV line. To plug in your IV line, you will simply pull out the plug from the port, take the cap off of the pointed bulb, and insert the bulb into the bag until fluid begins to flow into the line. You'll let fluid flow through the line until the line is full and all air bubbles have gone all the way through. You can then close the line by rolling the dial shut or using the pinch. Always keep the end cap to your line to keep it sterile. To read the fluids on the bag, you will go by the lines. Each line on this bag is 100 milliliters of fluid. This bag is a little different. The first line on this bag is 100 milliliters, then each tick mark after is 50 milliliters.
Administering sub-Q fluids is generally a two-person job. One person will restrain the pet and hold the line, and the other person will administer the fluids. When you're ready to place your needle, remove your needle from its plastic coating. Remove your protective cap. Twist the needle on and twist your lure lock to make sure your needle is in place securely. Remove your cap from your needle, and you're going to pinch up an area of skin just around the shoulders that's loose and lift it up. There should be sort of a triangle here. And use your finger here to sort of ensure that you're in that triangle. And in a quick, swift motion, you're going to insert your needle. And then the person holding the pet will secure the needle and the line to keep it from moving. And to make sure that you're actually in the subcutaneous area and not gone all the way through the skin, you can release the line and watch for any fluid that may be beading up in this area. When there's none, you can proceed with administering. You can also see here that the fluids are flowing. You can apply some pressure to the bag to make those flow faster. Once you have administered the desired amount of fluids, you'll stop your flow with the dial or the pinch clip. You want to secure the skin with your fingers on either side of the needle. Remove the needle. Hold this secure for a couple of seconds to a minute to make sure that it doesn't leak. And then you're going to recap your needle using the one-hand technique. It's normal for some fluid, even some blood tinge fluid, to leak out in this area.